Why laser blepharoplasty is better than traditional blepharoplasty that's performed with a scalpel or even electrocautery. My patients ask me that question pretty often, and the answer is straightforward. The cut that's produced by a laser knife is far superior to a scalpel cut or radiofrequency cut. CO2 laser knife cuts and coagulates. There is a lot less bleeding, swelling. We actually had patients who had no bruising after surgery, which is virtually impossible with conventional blepharoplasty. Laser knife cuts precisely, smoothly. When you compare under the microscope the cut, the incision produced by the CO2 laser knife, it's straight, it's beautiful, it's ideal. The cut that's produced by a scalpel in high power microscope looks like a torn wound. There is a much higher rate of complications after the traditional blepharoplasty performed with a scalpel than with a laser knife. And many of our patients commented how quickly they recovered after laser-assisted blepharoplasty. Not only we are excising the extra skin, but we also cut the fat that's prolapsing, protruding from the orbit with the laser knife. And the appearance of patients after the laser blepharoplasty is very different than with the conventional blepharoplasty. Scarring is virtually impossible to detect after 6 months. When patients come in the clinic and I look at their skin, I cannot find the incision that I performed 6 months ago. And I will show you some examples of patients who came to the office less than a year after their surgery. There are no scars at all, at all. The beam of laser is so much more gentle on the skin than the scalpel or cautery. It's uncomparable. I have been performing laser-assisted blepharoplasty for a number of years now. This is my preferred way to operate on patients. Actually, the best surgeons in the country use only laser. Famous doctors like Joe Niamtu in Richmond and Dr. Lopa Gupta in New York City, they have been performing for many years laser assisted eyelid surgeries, and this is the only way they do it. Now we have CO2 laser assisted blepharoplasty here in Great Falls, Virginia, in a beautiful suburb of the greater Washington, D.C. area. My name is Dr. Leila Kamp. I'm an ophthalmologist, I'm a microsurgeon, and I do recommend that when you're considering your eyelid surgery, talk to your physician about the option of laser-assisted blepharoplasty. We're available for consultations 6 days a week. Consultations are in person or virtual. You can call our number and we will be happy to explain to you what would work the best for your eyelid surgery.